Molecular breast imaging is the least expensive and the most specific, meaning that if there's a cancer there, it's the most likely modality to find it. With molecular breast imaging, the breast is just stabilized. It's not compressed. It doesn't hurt, and it's very comfortable for the patient. So that part's not a problem at all. Many patients who are newly diagnosed with breast cancer cannot undergo MRI for various reasons, whether it's issues with claustrophobia, size, etc. In those patients, it's an additional enhancement, and it's important that we do additional imaging in any woman with dense breasts because there is an increased risk of developing an additional breast cancer in the involved breast or the opposite breast. So if we can't do the MRI, then we do the molecular breast imaging. We also use it as a problem-solving tool in women that have a lump or a problem that the mammogram just really doesn't show exactly what the problem is. And the ultrasound even doesn't show exactly what it is. It's great because when you do the exam and you don't see anything, it's very reassuring because it is such a sensitive and specific test. We know that if we don't see anything, it is most likely nothing. You have to have good flow for your patients. They have to have a good experience. They have to have a positive experience, and that they have every opportunity to find out exactly what's going on from the diagnosis through the treatment and then beyond. This center offers more than that. We try to find the lesion as small as possible, and then once we find it and once we take it out, how do we treat that patient? What else can we do for them aside from the chemotherapy or radiation therapy or lumpectomy or whatever is necessary? How do we help them nutritionally? How do we help them with finding better energy, better peace of mind for not just the patient but their family? It's really amazing how far we've come. It used to be you could barely see the lesion on a mammogram, and now you can not only see the lesion, but you can sometimes find it as small as 2 millimeters, potentially with molecular breast imaging. The technical support from Gamma Medica has been great. Fortunately, we've not had a lot of issues, so we haven't needed a lot of help. That says a lot about the company and their product. They definitely have been here for us when we've needed them and gone above and beyond. If I didn't have the MBI here, I would feel like we were really missing a piece of the puzzle. And it absolutely gives me peace of mind to know that we can offer this kind of technology to our patients, to know that they're going to be okay.